Valery Feigin, Professor of Neurology and Epidemiology and Director of the National Institute for Stroke and Applied Neurosciences of Auckland University of Technology, New Zealand. Well, I am involved mainly in epidemiological research, both observational and experimental, such as randomized controlled trials, mainly in stroke and other major neurological disorders, particularly in the area of prevention. In that, I am focusing on scalable and potentially most effective interventions, which, if proven effective, could be rolled out across the globe, including low-resource countries. And I would also like to add that this neuroepidemiological research is actually fundamental for preventing stroke and other major non-communicable neurological disorders, as well as for evidence-based healthcare planning, priority setting, and resource allocation by policymakers. So these research findings are basically forming the basis for evidence-based medicine for neurological disorders. Neuroepidemiology is important for several reasons. First and probably foremost is that neurological disorders have become one of the leading disorders in terms of the burden in the human populations, in terms of incidence, mortality, prevalence, disability. They have actually taken combined with mental disorders affecting approximately 4.3 billion people worldwide. It's an enormous problem, and it was projected that the burden of neurological disorders will double by 2050, unless, of course, something really effective will happen in terms of the prevention and improvement of outcome of those disorders. And because neuroepidemiology is exactly to address the issue of frequency determinants and effective interventions for neurological disorders, this is absolutely crucial field of research to reduce the burden of neurological disorders. I am only involved in clinical research and both observational studies like incidence, outcomes studies, studies of prediction of the occurrence of stroke and other neurological disorders, and experimental studies such as randomized controlled trials. And I'm currently involved in several large full-scale randomized controlled trials, both nationally and internationally, primarily in the area of primary and secondary stroke prevention, and specifically with some innovative digital tools for general population and clinicians. And I can give you an example of some of the tools, like internationally endorsed and freely available to use stroke riskometer app supported by the World Stroke Organization, World Heart Federation, World Federation of Neurology, European Stroke Association, many national stroke organizations. This tool is for general population and also endorsed by major international organizations, web app called PreventsMD, which is also a preventative tool primary and secondary stroke and other NCDs prevention tool, but for clinicians to use on the desktop computers or tablets. And there, I must also admit that there is a really reasonable expectation that these trials, which I'm currently involved in, may actually change the current practice of stroke prevention, radically change, improve. Yes, I personally and my team are collaborating with a number of industries in New Zealand and internationally. And these collaborations are actually growing almost every month because more and more companies, industry organizations recognize the unique opportunities that we are offering by our digital technologies to improve health and brain health in particular. Through several mechanisms. First of all, they allow to estimate the risk of having those disorders in the next 5 to 10 years. And not only in absolute terms, but also in relative terms, which is far more important for motivating people to do something about their risk factors and to do something to reduce their risk. Overwhelming majority of people have no idea about their personal risk of having a stroke or dementia or brain disease, various kinds. Our tools provide those estimates, and through that, people know that their risk is increased, say 2-3 times or more compared to someone of their age, sex, and ethnicity, but without any additional risk factors. And this is a motivational factor, isn't it? If your risk is 2 times of someone of your peer, you naturally ask a question, why? So our tool provide the answer to this question. They show the risk factors any individual has that explain the increased risk of having the disease, in our case, stroke. And then we provide evidence-based recommendations how to reduce the exposure to those risk factors, how to reduce their risk. Yes, I am affiliated with many societies and organizations. I am just a few examples. An affiliate professor of global health at the Institute for Health Metrics and Evaluation of the University of Washington, D.C., visiting professor of Capital Medical University of China, a fellow of the Royal Society of New Zealand and American Academy of Neurology. I'm also co-chair of the Global Policy Committee of the World Stroke Organization and Neuroepidemiology group member of the World Federation of Neurology, a member of the Technical Advisory Group on NCDs, non-communicable disease-related research and innovation of the World Health Organization. I am also very closely involved in the Global Burden of Disease project, leading or co-leading activities concerning stroke and neurological disorders estimates. Yes, my main role across all these societies and organizations is to advocate and support implementation of all the advances in stroke and other neurological disorders, particularly prevention. That's where I'm focusing. Care, research, and rehabilitation. Many of the projects I've been involved through these organizations are now being implemented in practice, including national and international guidelines. As you know, Neuroepidemiology journal is a very well-known, internationally respected journal. And I use publications from this journal all my time in research since the establishment of the journal in 1982. I was a very junior researcher at that time, and the journal was established by very famous neuroepidemiologist Dr. Bruce Schoenberg, who unfortunately died in 1987. Since then, American Academy of Neurology has very prestigious international Bruce Schoenberg Award for the best neuroepidemiological studies. And in 1995, I was honored to be one of the first recipients of this award. So that was my first kind of introduction to neuroepidemiology. And towards the end of 2007, I was formally approached by Professor Gustavo Roman from the United States, who at that time was the editor-in-chief of Neuroepidemiology, and he told me that he's going to retire from this position soon, and he actually offered me to take up this position after him. That's how I was introduced to neuroepidemiology. I believe that neuroepidemiology is a basic science for clinical neurology, as I already mentioned, and there is no clinical study, frankly, whether it is a case control study, cohort study, or clinical randomized control trial. None of those studies would be possible if they would not be based on the neuroepidemiological methods. And in this sense, what we are publishing in our journal, studies on frequencies, determinants, and prognosis of various neurological disorders using different methodological tools, is the foundation for evidence-based medicine in neurology. And being at the steering wheel of all this activity is a great honor and responsibility, which I really value. And another reason for me to stay with Karger is the great team of Karger I am working with. Also, the journal Logistics, Neuroepidemiology journal Logistics interface to manage submitted manuscripts is constantly improving, which is also quite appealing for me to be involved in and use it in my role as editor-in-chief. It's great support for me as well. All of this make me quite certain that I would like to stay with Karger. I'm very confident that the journal will continue its legacy as one of the most respectful international journals. Every scientist would like to submit their best neuroepidemiological manuscripts to. Our journal is the only journal, and this is quite frankly the only journal in the world that is entirely devoted to the epidemiology of neurological disorders. And as I mentioned at the beginning, the burden of neurological disorders is projected to double by 2050. And the significance of neuroepidemiological research, and therefore the significance of the journal, will only grow. So in my view, the future of the journal is quite bright and exciting. There are a number of ways people need to accommodate to get their research published. And the most important is very sound, robust methodology of the research, novelty of the research questions, and their practical significance. I think those are the two major kind of elements of the success for manuscript submission.